So to wrap up our session, I'll be talking about really the next steps. How do we put into action what all of our panelists have brought forth as problems really here today? So how can our guidelines best address DEI? I have no conflicts of interest. Valuing health equity or distributive justice is one of the four core moral values of medical ethics, along with individual autonomy, non-malfeasance, and beneficence. Although distributive justice is typically thought of in reference to reaching the largest number of people, meaning vertical equity, prioritizing health equity over efficiency leads to a larger benefit for those that are reached. If consequences for health equity are not assessed, health programs and policies run the risk of fostering and even worsening inequities. Ideally, guideline panels will explicitly weigh equity considerations using a fair, deliberate process with opportunity for revisions based on feedback and consultation with relevant stakeholders, such as patients and clinicians. The GRADE approach, which is the most widely used framework in guideline development, published in 2017 an equity series which sets standards for considering health equity issues in guidelines. By discussing directly how different equity factors can affect the direction and strength of recommendations, GRADE helps inform additional considerations that may impact individual patient, clinician, or policy-making decisions. They started with the development of the acronym Progress Plus to identify individual and context-specific characteristics across which health inequities may occur. Health equity is important for two main types of guidelines. First, the universal interventions where health inequity is a concern. For example, the recommendation is that individuals receive a colonoscopy for colon cancer screening. However, there's evidence showing that African Americans are less likely to undergo that screening. Secondly, targeted or dedicated interventions aimed at one or more disadvantaged populations that have experienced health inequities. For example, this guideline would develop recommendations to increase colon cancer screening specifically in African American communities. GRADE proposes 9 stages of the total 18 within guideline development in which to specifically consider equity. First, deciding that addressing DEI is a priority for your guideline. Then ensuring a diversity of membership within the guideline working group and identifying your target audience. Generating guideline questions that take health equity into account and consider the relative importance of specific outcomes and interventions in the setting of diverse patient values. You want to search for published literature that addresses the landscape of health equity in that specific area. And when summarizing the evidence, explore additional considerations for diverse patient populations. You want to use inclusive speech in the wording of your recommendations. And lastly, evaluate how the guideline has been implemented in practice and whether unintentional disparities have arose after publishing the recommendations. After systematic review of the literature, while you are synthesizing and grading the evidence, the following 5 methods can be used to assess health equity within the evidence. First, include health equity as an outcome. Consider patient-important outcomes relevant to health equity. Assess the differences in magnitude of effect in relative terms between disadvantaged and more advantaged individuals or populations. And assess differences at baseline risk and hence differing impacts on absolute effects for disadvantaged individuals or populations. Lastly, you want to assess the indirectness of evidence. Direct evidence may be lacking for several reasons. Some populations may not represent a large proportion of trial populations, such as migrants or refugees, or may be explicitly excluded from a trial, such as patients with multiple comorbidities. Because multiple comorbidities are more common in socioeconomically disadvantaged people, this may result in disproportionate exclusion of disadvantaged populations from trials, thus resulting in evidence that may be downgraded for indirectness if it is not comparable with the guideline population of interest. Another example of this is in regards to brief alcohol counseling for people with hepatitis C infection. Evidence shows that there's a 38% decrease in alcohol consumption across 22 randomized control trials. However, none of these studies included patients with hepatitis C. This outcome would then be considered indirect, and thus the certainty of evidence would be downgraded. After grading the evidence, panels convene to make component decisions about that evidence, using the evidence to decision tables as the framework. On this slide, you can see the 7 traditional components to all guidelines. The Grade Equity series recommends adding health equity as an 8th component to the ETD framework by considering these 4 questions. Are there groups or settings that may be disadvantaged in relation to the problem or intervention of interest? Are there plausible reasons for anticipating differences in the relative effectiveness of an intervention for disadvantaged groups or settings? Are there different baseline conditions across groups or settings that may affect the absolute effectiveness of the intervention or the importance of the problem for disadvantaged groups or settings? Lastly, are there important considerations that the people implementing the intervention should consider in order to ensure that inequities are reduced, if possible, and that they are not increased? To wrap up our session, we have a long way to go in addressing health inequities, specifically in access to surgical care. But due to the reach and influence of SAGE's guidelines, we have an opportunity to be leaders here by being one of the first surgical societies to address DEI within our guidelines. And while current evidence may be limited in this area, a key component of guideline recommendations is establishing future research priorities. This could help us focus our research efforts to areas that need investigation most. Thank you.